Dr. Julie Mayer, who's our, now she's local. She's just moved to the Valley from the Chicago area. She's been a rehab vet working on performance dogs for well on a dozen years or so.
Yes, for about 12 years now.
Good. Well, one of the things I'm doing in this blog is working with novice handlers, and we'll be focusing on handling and training techniques and foundation work. But something that maybe novice handlers don't think about a lot is the dog that, the tool that they have, whether you're playing with a wooden tennis racket or a graphite one. And so I know there's some things that we can do to make sure our dog is ready to get up off the couch and out onto the performance fields. There's probably some things we can't do much about, but there's other things they can. So I want to ask you about that. So in your experiences, just generally running into people starting with a performance dog, what do you generally see to be problems?
Definitely, we need to look at their weight because we don't want them to be overweight running the courses, and there's a lot of concussive forces on their joints, and the heavier they are, the worse that could be. Or heat exhaustion, obviously being in Phoenix, that's an issue. So we look at the weight, and we actually score them. It's called body condition scoring. And what we'll do is we'll look at their torso, and we look at if we can feel the ribs with light pressure. We'll also look at we call it kind of the flank area, and we look to see if they have a tummy tuck.
Oh.
So we look from the side, and we look from an aerial view, we look over the dog, and then we see if there's an hourglass waist. So we kind of judge based on those parameters, and then we score them. And the score is either from 1 to 5 or 1 to 9. It just depends on what grading scale you're using. And obviously you want something right in the middle. Maybe a little less, maybe, a little below average, because if they're running, you really don't want any kind of weight on them. So we can, you want more muscle tone than you do want them to be just, physically looking fit.
And you're going to show us in a little bit just how to do that. Okay. Well, one thing that strikes me right off the bat is, I've been to my vet, and they say, well, your dog looks fine, or your dog looks skinny, because I have performance dogs. But you don't seem to be the typical vet on that score. Most of them kind of like the dogs a little porky.
Right. I definitely like them underweight, and that's because with doing rehab for 12 years, a lot of cases that come in the door, as soon as they lose weight, the limping goes away, the lameness goes away, the issues go away. So, just prescribing some weight loss alone can actually cure a lot of ailments that are happening with the pooches.
That's because why? What's actually going on there with the weight?
So what's happening is if there is too much weight, it's putting a lot of forces on the joints, on the tendons, the ligaments, changing the biomechanics of the dogs, and just cardiovascular wise. So just like with us, you're more prone to heart disease, diabetes, and some diseases like that. But definitely just structurally, we're seeing that there's the more weight that they have to carry around, and they're jumping on jumps and, on the equipment and things like that. It's really, really hard on their joints.
And I know some of the agility organizations even allow for, I forget what they call it, but sort of it's kind of about proportions. You have the Basset Hound or some of these other breeds that are kind of more bone than leg, or more body size than leg, and so that some breeds probably just are structurally built differently and maybe can't take quite the forces.
Yeah, that's true. And with the courses that are out there now, there's different, styles, different venues, but definitely, these long back, short leg dogs, that's pretty tough for them to maneuver around the equipment. And especially since a lot of the equipment is standard, no matter, what the physical make of the dog. So, yeah, that, when we look at those proportions, that could be a little difficult. You want them to be boxy. You definitely want them to have some angulation. So you look at them from the side, and you want some angulation in all the big joints, kind of like a Z formation. So from the shoulder blade all the way to the toes, also in the rear. So if you look at them from the side, you don't want anything too straight. I see straight shoulders, straight elbows, and straight hocks. And when I see straight hocks, which is the ankle, that can actually change your knee,
Oh.
and it can cause a lot of subluxations of the knee, and that would obviously make performance difficult.
So does that mean then if you look at your dog and you go, oh my God, they're all straight and square, I can't do agility with this dog? Or-
Not necessarily, but you need coaching. You need coaching with particular physical therapists or veterinarians who are trained in sports medicine, because you can teach them to try to maneuver with those. I'll call them abnormalities, but no, that doesn't mean that they can't run agility. They may not, be the top dog, but you want them to have safe fun for
Yeah.
sure.
Now back to the weight. You've probably run into this more than I have, but occasionally I've had a student I could see that the dog was overweight. It's a touchy subject to bring up.
Yeah, it's touchy for us as well. It's a lot of Americans people are overweight, and of course their pets are overweight as well. Their children are overweight, so they think it's a reflection of them. They feel very guilty, but they should be, because unfortunately they're in charge of what they're feeding their pet and how much they're feeding their pet. So as an advocate, we have to put it on the table. We have to get it out there. We have to make sure that we can, show the owners what is going on, because they just say, oh, look, it's all fur, or, there's always excuses and things like that. So we definitely have to point this out. We could do body condition scoring. We could show them weight on the scale, and we have to tell them all the dangers, and especially if they want to do any sports activity. So again, just being the advocate of the dog, it's our job, and no matter what, I think just if you approach them with the medical aspects and you turn it into that, I think they typically understand what needs to be
Those
done.
surgeries get expensive.
Yes, exactly.
But what do you say? People say, I looked at the bag of food says to feed this much.
Yeah, and definitely most of the bag, even the premium diets, they definitely tell you to overfeed. So just like you and I, if we ate the same thing together all the time, you and I would gain weight differently. So everybody's metabolism is different, their activity level is different. So it's based on every individual. So you can't take a bag of food and have everybody, feed the same, oh, my ideal body weight should be X amount for my dog. And you could have 5 border collies and they're all, you feed them all the same amount for 40 pounds. And lo and behold, some of them gain weight or not. So there is individuality for sure. And so we approach it that way. We have them shave the food a little bit, so take off maybe about 25%, see if that works. We also look at the treat factor, because
Right,
they're
that's
in
probably
training.
yeah.
They're in training. So you look at, can we substitute treats? And that would be, I'll use Cheerios, or I'll use like Charlie Bears, because we know that they're 1 calorie.
Oh,
Sometimes you could call the company and you can ask them how many calories are in each little treat. But what I'll do too is Cheerios. I mean, a lot of dogs, they don't care what you're
Right,
giving
right.
them. Or if they do, if they're finicky, then what I'll do is I'll actually put them in a jar with another treat that's very meaty and very smelly, and it kind of absorbs the odor from that. So.
Good point. Yeah.
And that goes over pretty well.
Yeah.
Because again, doing rehab with these overweight patients, we want them to, we have to lure them on some of the equipment, and obviously we don't want to use bait. That's going to be high calorie.
Yeah,
So
yeah. And like with people, they say try to lose a pound a week. That's a safe dieting. What about with dogs? It's harder for dogs because we control it. We could just slash and burn.
right,
Is that-
yeah, you definitely want to be. Involved again with your veterinarian or with sports, somebody who knows about weight loss and can help you guide on that, because usually it's about 1% of the body weight a week. So you have to be really, really careful, 1 to 2%, and you have to look at that patient. Are there other pre-existing conditions? Do they have heart disease? Do they have anything else happening? So definitely you need some guidance as far as if you need to have some serious weight loss. I definitely would seek the guidance of your vet.
Well, you know what? Let's break here and then do some hands-on. And sounds good. Thanks.